Eyes are the window to the soul, and for many pet owners, there's nothing quite like receiving a loving gaze from your pet. Eye health is hugely important in animals, but many creatures like cats and dogs can develop eye conditions that aren't picked up by their owners until it's too late. In this episode of Creature Tales, professional interest practitioner in ophthalmology Melissa Meehan takes us through what to look out for when it comes to the eye health of cats and dogs, and even elephants and ferrets. Hi Melissa, thank you for joining me. I might get you to start by telling us exactly what a professional interest practitioner in ophthalmology really is.
Well, it's a vet that has a special interest in ophthalmology. And ophthalmology, of course, is the study of the eyes. That special interest for me was obtained through doing not one but 2-part residencies in specialist clinics, working under the supervision of specialists and logging lots and lots of different cases and in a formalised process. I didn't complete the residencies, but in the process of doing all of that since 2008, basically immersing myself in ophthalmology, I have learnt an immense amount in the subject and presented at lots of different conferences and to peers. And I think since 2009, 2010, I've been here part-time helping shelter animals and private cases.
And what is it about the eyes that just got you so interested?
Look, I think I liked it right from the start. It's clean. It bleeds a little bit, but it's not generally smelly or pussy. It's a long way from the back end. And there's lots of cool instruments that you need to look at eyes. You can't do an ophthalmic examination without them, like a slit lamp and a tonometer that measures the pressure, indirect ophthalmoscope, and I like all those fiddly things. It's also not just consulting and examination, but 50% of it is surgery, and that surgery is microsurgery. So you have specialised micro instruments and you work by looking through an operating microscope, which means that you look forward and it projects down and you work on a very microscopic level. So it's pretty cool in all those aspects, I think, anyway.
And I think I remember you saying it's unique in that most of the organ is exposed, unlike the other parts of an animal.
Yeah, that's right. It is. And you can see right from the eyelids through to the retina and the optic nerve. You can see everything, all with those instruments that I was talking about. So nothing's hidden from you generally in the examination, and you can usually see disease.
And I would love to hear about some of the more unique eyes that you've treated. Can you take me through some of them?
I've treated some awesome broad spectrum of animals I've seen at the zoo. When I was doing my residencies, we went to Werribee Zoo and we saw a gazelle there, and then we went to Melbourne Zoo. I saw an elephant. That was a very interesting examination because we couldn't go very close because it was a bull calf, and wow. It was just learning its boundaries. So they actually wouldn't let you get further than 40 centimetres from it, but we were still able to solve the problem. Birds of prey, owls, frogs, lizards, fish. Done a graft on a ferret.
And when you say microsurgery, that kind of puts it into perspective for me when you say something like a ferret. How much concentration is required for something like that?
Well, yeah, lots. I think that's what I like about it. I suppose no more than any surgery, but it is focused in one particular small area, and it's not very forgiving. Yeah.
And something like, everyone knows the term eagle-eyed. Is that a term that is justified for eagles?
It is, yes. I mean, they are incredible. Their eyeball is pretty much the same size as ours, but they're much, much smaller in size. It takes up half the size of their head. It's bigger in weight than their brain. So, wow. It's so important to them that they've evolved to have that. If they see a rabbit from like 3 kilometres away as they're flying, they're able to hone in on it and swoop down. And as they're descending, they can maintain focus, and wow. So they can catch it in the end. We've got 20/20 vision. They've got 25 vision. So something that we can see from 5 feet away, they can see from 20 feet away.
Wow.
So it gives you an idea on how amazing they are.
And when you mentioned the elephant before, I know you couldn't get up super close, but what can they see? Can they see what we see?
Yeah, that's a good question. It's really hard to study what exactly animals can see. You can look at the retina to have a look at the concentration of photoreceptors. There's ones that see at night, they're called rods, and ones that see during the day, and they're called cones. And certain species have been studied better than others. The species that have been studied really well are dogs. And if we were to talk about what they can see and what they can't see, they're not colourblind, but they're thought to be a red-green colourblind. So the interesting thing with that is that if you're giving your dog toys, then you need to give them toys that they can see. So if you give them a pink toy and you throw it in the grass, they're probably not going to be able to distinguish it that well from the grass itself. And so people will come in and see me and they'll be like, they're not seeing their toys very well. Ask what colour they are. If they're blue or yellow, then they're going to stand out to the dog much better.
Wow, that's amazing. I don't think many people would know that.
No, and even toy companies should know, shouldn't they?
Yeah.
Because it would make their toys more useful.
Wow, so where did that myth come from that dogs could only see grey?
It was started just by the hypothesis that I think looking at the fact that they couldn't see certain things, and so it was just assumed that they couldn't see very well. But we know they've got much better night vision than us because they are hunters. They've evolved to be hunters, so they need to be able to see at night, and they need to be able to see things that move very quickly. So they're better at that than us because they've got more rods in their retina, but they're not so good at colour because they don't need to be.
And we are talking about dogs, and are dogs the animals that you do see most frequently?
Nowadays, yes. I think it depends on where you're working and what you're focusing on. Dogs, cats, rabbits and ferrets, some, other rodents, but they're the predominant ones. And here I see some of the animals in the barn as well.
Oh, wow. So what are the common issues that you're seeing day to day?
A lot of the things that I'm seeing, frustratingly, are things that probably, if we had bred certain breeds better, I wouldn't see them. And whilst they do provide income, I would rather not be getting anything from those animals. They're animals that have got squashed-in faces, so brachycephalics, and I see a lot of pugs. Owners are completely unaware that the dogs have got pigment, brown pigment, which has grown across the surface of their eye, the clear window of their eye, and they can be 50%, maybe more, blind. And dogs don't already see very well. So with these dogs, it's like wearing very, very, very dark sunglasses. And, they're just getting around like that. And it could have been prevented if they were seen earlier.
What's that experience like for an animal to slowly be losing their vision? Is that traumatic for them?
Dogs are nowhere near as dependent on their vision as we are. And I think when you study and understand how they see things, you understand why vision isn't as important to them. And their sense of smell and hearing is just so much more advanced than ours that's their vision substitute, even when they can see. So if you take away their vision, they don't miss it as much as we do. And they're quite pragmatic, aren't they? I mean, they can lose a limb and they just get on with the show. They lose their vision. If it happens slowly, they do adapt, and I find those dogs are incredible, and the owners will often not really realise until they take them out of their own environment, and then they'll bump into something. But I have a blind dog. Most people can't tell he's blind. Wow. And dogs that are blind map their environment amazingly well, and they'll remember it, and they go back into that environment and they don't bump into anything. But if they lose their vision quickly, it takes them about 3 months to adapt. They do get depressed.
Back to what we were saying a little earlier about breeds like pugs that have those smushed in faces. Obviously they're a very popular breed, and you were saying sort of people don't know about that. Do you think that's something that the public just needs a bit more understanding of, that these breeds do have these side effects? Yes.
I'm mentioning pugs because they're the main one that I see with ocular problems, but all of the other breeds like bulldogs and the other brachycephalics can be affected by airway disease as well. And there is a campaign with regards to those problems, but the ocular problems are something that's linked to all of that anatomical deformity that's been bred into those dogs.
And I think I remember you saying that their function has been taken away from what it's meant to be, basically, through this breeding.
It has. The dog's nose is meant to be, as I was saying before, their best asset. And these dogs' nostrils are so small that they can't even breathe. So these dogs can't do what they're meant to do, which is to just exist, have fun, play on a hot day, not even a hot day, but a day that's just mild, not be affected by the temperature, and be able to see with their eyes without having a pigment grow across them just because they're too big. But in answering your question before, you asked whether if people were more educated about those breeds, whether these things could be prevented. Definitely yes. I think then they would demand from breeders to select for dogs that have got smaller eyelid openings and longer snouts, for example.
Do you think that pet owners in general are quite vigilant when it comes to the eye health of their pets, or is that an area that you think needs to improve?
I think good owners are very vigilant because humans really value their vision, and so we value our pets' vision. And I think that there's no issue trying to get a good owner to come in early when it comes to eyes. Bad owners that aren't really concerned or not taking much notice about their animal's health will miss ocular problems. And they can be very painful. They usually are. That's something for people to keep in mind.
So what can they look out for, those owners?
Yeah, mucky discharge is one of the things, but in the early stages there might be not much to see. It might be just an intermittent, pesty little mucky discharge that's there, the owner wipes it away and it goes away. And a bit of redness maybe, and then as the disease progresses you'll get squinting and obvious signs of eye disease.
And for people just at home that want to take the best possible care of their pet's eye health, what are some things that they can do? Are there foods that they can give them that are really good for eyes, or exercises or anything like that?
Yep. Good food, good nutrition will definitely help all parts of the body. We know that certain antioxidants and things can, definitely good food. In terms of exercise, probably there are, but we haven't come up with any yet. But in terms of knowing what to look for, any discharge, any redness, any squinting, rubbing of the eyes shouldn't be taken lightly. And if it doesn't clear up within 12-24 hours, then that dog should be taken to the vet. And if you are going to the vet and it's taking weeks for something to heal, then maybe ask for a referral.
And so aside from the brachycephalic breeds, what other kinds of issues are you commonly seeing?
There are a number of cases which I see in here. Sadly, I've been seeing a lot of cats recently that have been struck down with a really nasty strain that we're seeing this year of herpes virus when they've been neonates. And they can get really nasty ulcers from feline herpes virus, corneal ulcers, and those ulcers can rupture if left untreated and the eyes are lost. So that's one of the most common things at the moment. Other things that dogs can get that cause vision loss range from ulcers, and that can be due to another common disease we see, which is dry eye. And that's something that I do see in inspector cases here that I've been referred. The other thing that I see is glaucoma. And glaucoma is something that unfortunately some breeds are overrepresented with. People suffer from glaucoma, but in people the glaucoma that they have is usually very slow to progress, and they don't get acute increases in pressure. In dogs, we find that they get acute increases in pressure, and the type of pressures that these dogs are putting up with can be up around 60. Anything above 25 is considered too high. A lot of dogs are very stoic. They might be just squinting a little bit, or they might rub their eye a bit. What can they do to tell their owner that they've got a migraine? It's other than sleep. And if you're busy, then you miss that sign. So I think we need to, if your dog's sleeping more, or if they're a bit more introverted, you need to take the time to just monitor for those things. They're really quiet about how they go with dealing with pain.
What kind of pain are we talking about? How bad can it really get?
Well, I've spoken to people who've had pressures that are like that, and they have got agonising pain and migraines. And these dogs will come in and the people will say, no, they're fine, they're still eating. But I think what people don't really realise is that dogs hide pain, and they'll put up with a hell of a lot because they've got no other choice. So once we remove the pain and fix the problem, almost every time they'll say, oh, they're like a puppy again. And that's just goes to prove how uncomfortable they were.
Is that one of the biggest challenges of your job, seeing these animals come through and knowing how much pain they've been in?
Absolutely. I can think of one case where there was a dog that I was seeing for quite some time, and the pressures were tolerable. The dog had a relationship with a member of the family that they were very uncomfortable about putting that dog under anaesthetic. And it did get to the point where the dog was in such pain that it was a welfare issue, and it did have to be dealt with by the inspectors. That dog subsequently has been adopted by some amazing ladies. She doesn't have any vision, but she has 2 prosthetic eyes.
Oh, wow.
So I put some prosthetic eyes in.
Oh my gosh.
She suffered from glaucoma, as I said before, which was couldn't be treated anymore. And she plays with toys, she runs around, goes on walks.
Oh my gosh, so does a prosthetic eye just look exactly like as close to a normal eye as possible?
It moves and functions like a normal eye, but it looks a bit grey. Yeah. So it looks like an eye with a cataract.
And so what's that like for you in those cases where you can make such a huge difference?
That's very rewarding. I still see that patient, and to see how much joy those people, those ladies are getting from their relationship with that dog and how happy she is. It just goes to show what a good job the RSPCA is doing in being able to give these animals a second chance. And that's why I'm here to help with those animals as they come through if they need it.
That was Melissa Meehan, professional interest practitioner in ophthalmology. Remember to be vigilant about your pet's eye health by noting any change in appearance or change in their personality and behaviour. I hope you've learned something new in this episode of Creature Tales. I'll be back again soon with another episode, and thank you for tuning in.